All right. Well, happy Thursday, everyone. Welcome to the August 5th AMCHP All-Member National MCH Policy Call / COVID-19 Town Hall. Packed agenda for you all today, so let's get started. As a reminder, you'll be in listen-only mode, but able to unmute during the Q&A. Please feel free to type in questions in the chat box at any time, and highly suggest you use the everyone option so that everyone on the call can see your questions. If you have any technical difficulties, feel free to send a message, though, just to the hosts and panelists, or email Jess Cohen, jcohen@amchip.org. For an overview of our agenda, I'll start with a very quick AMCHP policy update, turn it over to Laura Kavanaugh on behalf of the Maternal and Child Health Bureau, and then we are going to have our first guest presentation about the child tax credit, followed by another guest presentation about CAPTA reauthorization. So just to let you know where we are in the FY22 appropriations process, the House passed a combined bill on July 29th, just last week, that included the Labor, Health and Human Services appropriations bill, very exciting. This included $868.7 million for the Title V MCH block grant. That's a $156 million increase over FY21. And actually, if you're counting, it's even a little bit over the authorized amount for this program. Of course, the Senate still needs to act, but it is a very exciting development and such a reflection of Congress's dedication to improving maternal and child health and the resources available to do so. There was also increases for the autism and developmental disorders line, $4 million over FY21, a $56 million increase for the CDC Safe Motherhood and Infant Health line, and a $19 million increase for CDC's National Center on Birth Defects and Developmental Disabilities. Obviously, there's a lot more details in the overall appropriations bill. I just wanted to give some highlights about some of the programs we all interact with regularly. But again, the Senate isn't meeting to discuss this bill until September. A continuing resolution is likely. I doubt we're going to see a final bill passed before September 30th, but we are certainly headed in the right direction. And now I'm going to turn it over to Allison Northrup, who's going to tell you about a new tool that AMCHP has recently released. Allison.
Hi, everybody. So I am so excited to share that AMCHP recently published a tool that we're calling the Maternal Health Bill Tracker. And this is a tracker that we have had a tracker on maternal health legislation in previous Congresses. This is the only tracker I know of for this Congress that's out there that compiles and summarizes all of the federal legislation that has been introduced since the start of this year at the federal level regarding improving maternal health. And by my count, we're up to 33 bills, which is just incredible as a show of congressional interest in this topic. That really is, it's pretty unparalleled in the work that I've done on Capitol Hill to have this many bills introduced on a topic. So since there are so many, we put this resource together for ourselves to keep all of the bills straight. Many of these bills have some variation on the term mom in them, and they can often sound similar. And many of them do similar things. And so just wanted to create a resource that kind of cuts through the noise, gives key information about each of the bills that have been introduced, and importantly, their current status. And so you can see on just the screen grab here, that second column, the status shows you that this particular bill has been passed into law. We'll be updating this at least weekly. And so please, go to this site regularly. Please be in touch if you have questions or corrections or additions. We want this to be a living document that's reflective of user feedback and input. Just one note that So obviously AMCHP, we are the Association of Maternal and Child Health Programs, and this is a tracker about maternal health. And so I just want to kind of address that at the outset, that this is a start. My vision is that ultimately this tracker will be inclusive of multiple MCH populations. At the moment, there is a ton of congressional focus on maternal health in particular. And so this really is serving that service of differentiating between all of the bills that are out there. But again, it is just a start, and something that I'd like to build out over time that becomes inclusive of all of our MCH populations. So please use it, please provide feedback. You can contact me. There's also a government affairs web address that you can contact or share with folks who may have questions or comments. Thanks.
Thank you, Allison, for sharing that. And I'm going to now move us along to Laura Kavanaugh from Updates from the Bureau.
Thank you, Amy. Such a pleasure to be with you this afternoon. I'm Laura Kavanaugh, and I'm the Deputy Associate Administrator for the Maternal and Child Health Bureau. Next slide, please. I have two quick updates for you today, and then it's my pleasure to introduce our two speakers on child tax credits. First, just...
Oop, Laura, you just hit mute.
So sorry. Thank you for letting me know.
No problem.
The open enrollment period for the marketplace has been extended through August the 15th, which is rapidly approaching, and I just wanted to make sure you were aware of that. Next slide, please. Also just posted and available to you, the MCHB awards are now we're accepting nominations for 3 types of awards: the MCHB Director Award, the Lifetime Achievement Award for Title V, and the Vince Hutchins Partnership Awards. These will be open through accepting nominations through September the 3rd, and all of the information about the nominations and the procedures for submitting nominations are included on the website here. Now it is my pleasure to introduce our two speakers today. First, Mr. Michael Schmidt is a senior advisor at the U.S. Department of Treasury, where he's a member of the administration's Child Tax Credit team. He previously served as the commissioner of the New York State Department of Taxation and Finance and senior economic advisor to the governor. Next, we'll have Mr. Al Page. He's a senior stakeholder liaison at the Internal Revenue Service, where he's responsible for doing outreach and messaging to industry, associations, and tax professional partners regarding resources, guidance, and authoritative information available at the IRS. Mr. Schmidt, I'll turn it over to you.
Great, thank you so much, Laura. And I'm trying to turn my video on here, but I'm unable to do so. But I'm happy to get going on audio. I'm so thrilled to be here with all of you. Here we go. Great. Hi, everyone. So thrilled to be here. Thank you so much for having Treasury and IRS as guests at your meeting to talk about what is really a very, very exciting and an important issue, and that's the child tax credit. I'm going to just provide a high-level overview of the child credit and some important information you should be aware of before turning it over to Al. Child tax credit has been part of our tax code for a couple of decades now, but it had a dramatic transformation as part of the American Rescue Plan, and really as part of that expansion, there are 5 things that I want to make sure this group is aware of. The first is that the child tax credit is now very big. I mean, it expanded from $2,000 per kid to $3,000 per kid between the ages of 6 to 17 and $3,600 per kid under the age of 6. So, it doesn't, for a family with 2 or 3 kids, the amount of resources here really can be transformative, and substantial. And so it's a huge benefit for families across the country. The second aspect of it is what the tax experts would say is it's now fully refundable. And what that means is that under the old rules, it used to be that lower income families didn't get the full amount of the credit. The credit was limited for people with lower incomes. That rule is now gone. So regardless of your income, until you get to significantly higher incomes up to $150,000, you're eligible for that full credit amount. So even the lowest income families are eligible for $3,000 per kid, or for those younger kids, $3,600 per kid. So the anti-poverty aspects to this program are very, very significant. At Treasury, we estimate that families of 26 million kids under the old rules would have gotten a reduced credit because their incomes were too low. They're now getting that full credit. So that anti-poverty potential is really very, very significant. The third aspect I want to emphasize is that the American Rescue Plan kind of flipped the script a little bit in terms of how tax credits work. Typically, a tax credit, as we're all familiar with, you claim it with your annual taxes, which means for 2021 you would have to wait till April of 2022, or whenever you file your tax in 2022 to get that benefit. For the child tax credit, the American Rescue Plan instructed the IRS to make those payments estimated advance payments of the credit. So that means that families are getting advance payments on a monthly basis. So it's providing a steady stream of income into those families' bank accounts. It's very significant. It really almost reconceptualizes the program into something that's more akin to Social Security or other benefits programs. Incredibly important, and really recognizes the fact that families have expenses now throughout the year, that they can't always wait until the end of the year when they claim when they file their taxes to get those benefits. So that advanced payment structure is really a game changer, and truly transformative. The fourth point I will emphasize, and this is a very, very important one for us to focus on here, is that there are some families who will have to take action in order to get this benefit. So for the vast majority of families, the IRS has their information from previous tax returns and is making advanced payments based on the information. So if you filed a tax return in 2019, you filed a tax return in 2020, or even if you went onto the portal the IRS sent up last year, put up last year to help people sign up for stimulus checks, economic impact payments, the IRS will use that information to make advanced payments. But that means that people who haven't filed tax returns recently won't be getting advanced payments unless they take some action. Who does that include? Who typically doesn't file taxes? Well, it's usually families that make below the federal filing threshold. So that's $24,000 for a married couple. For a single parent, around $18,000. So it's the lowest income families, who again are eligible for the full benefit, who in some sense, really could use these resources the most, who do have to take some action in order to get the child credit. And so the IRS has put up a dedicated portal for non-filers, a tool that non-filers can use to sign up and get payments. And you can click through that tool at childtaxcredit.gov, childtaxcredit.gov being a broader website with a bunch of information on the child tax credit. So in terms of the individuals that all of your organizations work with, it could be that some people have to take action to get this benefit, and it's good to know that to be aware of that so that we can spread the word and get as many people signed up as possible. And finally, the fifth point I would make or make everyone aware of is that right now this is a one-year program. The American Rescue Plan put it in place for this year, for 2021. It expires at the end of the year. The administration has put forward a proposal to extend it into future years, to make it a real fixture of our system going forward. That will take action by Congress, and certainly that's something we all hope to see. So again, this is an incredibly important and transformative program. Millions and millions of kids, up to 60 million kids, are already benefiting from these payments. We can take more action to get more people signed up, which is incredibly important. And we need Congress to extend the program for years and years to come. So thank you again so much for having me. With that, I'll turn it over to you, Al.
Thank you, Mike. And Amy. Oh, okay. Again, thank you, Mike, and good afternoon, everyone. My name is Al Page, as previously stated. I'm a senior stakeholder liaison in DC metro area and Northern and Central Virginia with IRS Communication and Liaison Unit. Stakeholder liaisons engage community-based organizations to leverage communication of IRS's resource and information for the benefit of American taxpayers, just like we're doing today. First, I want to thank the Association of Maternal and Childhood Program and the Maternal Child Health Bureau for inviting me. Okay, next. I'm glad to have this opportunity to share important news regarding the 2021 child tax credit that will significantly benefit low, middle, and no-income families, as Mike just stated. Our objective during this presentation is to familiarize you with the eligibility requirements and resources available on irs.gov and share our partners' toolkit to share with your constituents and colleagues, and to assist your clients in determining eligibility and taking action needed to receive or unenroll or otherwise opt out of receiving the credit. But we in IRS also want to hear back from you on our feedback on our tools and products we're sharing today. So feel free to reach out to a local stakeholder liaison and tell us what you think. At the end of the presentation, I will post our general SL mailbox and on my personal email if you need for contact. Please place your questions in the chat box for response. At the end of the presentation, and if time remains, I will address your questions and concerns, and you can come off mute for Q&A. Next slide, please. Rescue plan also includes a significant expansion to the child tax credit, as Mike just previously stated. The enhancements that are designed to lift millions of American children out of poverty. So let's summarize the changes. The plan raises the maximum age for qualifying children from 16 to 17. It also increases the child tax credit from $2,000 to $3,000 for children under 6, for children for children 6 to 18 and under 18, and for $3,600 for children under 6. And for taxpayers whose main home is the United States for more than one half of the year for 2021. As Mike previously stated, the plan eliminates the maximum refund limit of $1,400 on an additional child tax credit that was in 2020. Also, it eliminates the requirement that the taxpayer has a minimum of $2,500 in earned income for the tax year. So what that means is that even families with zero income can get full child tax credit this year. And perhaps the most important provision of the plan is that it provides for advance payments of the child tax credit up to 50% of the estimated 2021 credit for taxpayers whose main home is in the United States, again, for more than half of the year. If you do not want, I do want to make note that the advanced child tax credit does not replace the 2020 child tax credit. The 2020 child tax credit is still in place, but with higher modified adjusted gross income thresholds and a full regular credit of $2,000. Next. There are certain basic requirements to get the full benefit in 2021. Again, first, United States resident. The taxpayer must have a main home in the United States for more than 1/2 of the year, or file a joint return with a spouse who has a main home in the United States for more than half the year. If not, the former rules will apply, where the refundable amount of the child tax credit is limited to $1,400, and the taxpayer must have at least $2,500 in earned income. Second, taxpayer identification number. The taxpayer and the spouse, if filing a joint return, must have either a Social Security number or individual taxpayer identification number, commonly referred to as I-10. Third, the modified adjusted gross income. The child tax credit is phased out at a certain level of income based on filing status. Low and no income taxpayers generally would not be affected by this phase out. And lastly, a qualifying child. A qualifying child for the taxpayer must be claimed as a dependent by the taxpayer on their 2021 tax return and have a Social Security number that will be valid for work. Next slide. Now I'd like to spend the remaining of the time in this presentation to direct your attention to a few resources on irs.gov as it relates to the advanced child tax credit. As you see, this is the irs.gov homepage. And on the homepage, you can immediately go to get the details on advanced child tax credit. Next slide, please. Once you navigate to the CTC site, you'll see guidance as to how to access to the CTC resources or assist affected individuals or family with attaining the CTC or child tax credit benefit. Most filers will not have to access this site and will automatically receive the 50% of the CTC based on their 2020 or 2019 return. However, some individuals and families may still need to access the site due to a change in circumstances with the dependents. Next slide, please. On this homepage, you should take note of these three portals. The top portal, Manage Payments, is where an individual may check to see if they are enrolled for the CTC, needs to make adjustments based on a change in circumstances, or update their banking or current address. This portal is also used to unenroll or opt out and elect not to receive the 50% child tax credit in 2021 on a monthly basis. If you don't have an existing IRS username or ID.me account, you will have to create one. There are instructions for this portal, and we'll show you a few of these resources in this presentation. ID.me is maintained by a trusted third-party vendor and not by IRS. The second portal is for non-filers, and that's the non-filer portal for those individuals or families that don't normally file an income tax return. Anyone that has a filing requirement should not use this portal. They should use their regular 1040 or 1040S return. They should file a regular 1040 or 1040S return. And those with filing requirements that try to use this form will cause a processing error in trying to attain the CTC. And also, we have a free filing portal on irs.gov for those individuals who qualify. And I think the qualifications is $75,000 or less, or under $75,000 gross income. The last portal is for checking your eligibility. This portal will ask you a series of questions, and based on your response, you should be able to determine your eligibility. However, you will not be able to file for the CTC using this portal. You must either have a current tax return or the non-filer tool, and you manage any adjustments in the Manage Payment portal. Next slide, please. Below the portals, you will see additional information that will provide guidance and resources. Publication 5534E provides e-posters with pertinent information regarding CTC. The Q&A section will provide general answers to most common questions. The individual or family would have to determine whether a response addresses their specific situation or circumstance. IRS's Q&As are periodically updated as we develop more experience with the public interaction with the CTC. There's also a resource guide section to provide a one-stop shop for material, useful, and outreach efforts. This homepage will provide you with different access to a variety of information. Next slide, please. Okay, let's go into which online tool should I use? Again, this tool will provide another way to access resources located elsewhere on the CTC homepage. We've seen the eligibility assistant and non-filer tool on this homepage. Next slide, please. This site will also walk you through on how to update and access your information for CTC consideration. Again, you must have identity established to use the IRS online services or set your identification using ID.me. The CTC update portal will be available this month and will help you with additional access. Next slide, please. As previously indicated, starting this month, the update portal may be used for changes in individual and family circumstances. And you'll see the light blue are hyperlinks. So when you access this page, you can just click on the hyperlink and it'll take you directly to the portal that you need to, where you need to make any adjustments. Next slide, please. Next slide, please. The FAQs are updated periodically for changes in our responses and for new circumstances that require a service response. A brief comment on topic H. You may receive up to 50% of the 2021 CTC in 2021. The remaining amount of 50% or more not received in 2021 will be reconciled on your 2021 tax return when you file in 2022, and it'll be based on your eligibility. Next slide, please. The resource and guidance section will direct you to specific events, and you don't have to back arrow to reach FAQs. You can always navigate to the FAQs from different pages. Next slide, please. We see another way to access e-posters in various languages for your outreach efforts. IRS encourages you to use these resources for your outreach efforts. Next slide, please. Here on this page, you'll see more resources, toolkits and other guides such as Publication 5537, IRS Toolkit 5538, which will be available in multi-languages, and ready-to-use articles and YouTube videos for your outreach effort. We will briefly review Publication 537 in a few moments. Next slide, please. IRS will house news releases in this site with periodic updates on our CTC outreach initiative that you can use for your newsletters. These news releases are available in different languages for your edification and review. Next slide, please. We also have tax tips to assist tax pros, organizations, and associations to assist individuals and families with obtaining the CTC. Revenue Procedure 2021-24 will provide the technical guidance for the advanced child tax credit. The special zip code data will assist organizations in targeting their outreach efforts based on the requirements that they have. Next slide, please. Lastly, let's take a very brief look at the Publication 5537 table of contents showing available information and resources in the toolkit for partners. This toolkit is very comprehensive compilation of outreach material and guidance on advanced CTC. Next slide, please. I think, go back one, please. Thank you. This toolkit will explain the CTC, access, and a variety of pertinent information, including navigating and interacting with various portals. And as you see on the table of content, it addresses a lot of basic questions that your constituents might have and your clients might have regarding the CTC. Next slide, please. And finally, you also see information for non-filers and those underserved communities, such as the homeless and transient individuals and families. Publication 5537 is a digital one-stop for information that will assist you in your outreach effort and provide substantial resources. And again, the information that you see is available throughout the Child Tax homepage, where you can access it in a variety of ways. The toolkit is very good in that it summarizes a lot of information in access in one area for your edification and for distribution. And I encourage you to share all this information with your colleagues and clients that you come in contact with. And lastly, last slide, and what questions do you have? And I will post my email address and the email address for stakeholder liaison if you have a question sometime later on in the future. Thank you.
Thank you, Al, so much. I think I dropped the Q&A page that you had in your slides, so sorry about that.
Okay.
I think it'd be helpful, yeah, for anyone who wants to, type questions into the chat box. This was really helpful. One question I have is, so if our members who are on the call today, if they want to embed any of this information into their own websites, is there a way to do that?
Yes, I would recommend that they look at the toolkits. We have e-posters and JP, flyers that they can embed into their website and into their websites and newsletter. And again, anything that's on irs.gov, feel free to use it because it's public domain information. And we definitely want you to, share it outside because our reach is somewhat limited. So we encourage people to use our information that you have and share it.
Thank you. And we do have a question about policy. If a child turns 18 during the year, will the payments come? Do they stop when the child turns 18? Or are parents responsible for paying when they do their tax return?
Sure, and that's a common question that we receive, and it is also a part of the FAQs. And the FAQ basically reads that a child is a qualified dependent if they have not reached the age of 18 by January 1st, 2022.
Kate, did that answer your question? Yes, okay, wonderful. Well, thank you so much. We're gonna move to our next panel right now, but again, Al, if you're able to stay on for a little bit longer in case there's more questions we can review at the end.
Sure, be happy to.
Wonderful. Thank you. And now I would like to turn it over to Carrie and Rebecca, who are going to give us an update on CAPTA. And Rebecca and Carrie, I wasn't sure who's going to start it off, but feel free to unmute yourself and turn your video on.
Great. Thank you. It's really nice to be with you all today, and thanks for having us. As Amy said, we're going to provide an update on CAPTA, the Child Abuse Prevention and Treatment Act. We're excited to be joining you today because it really is such a natural area of overlap between the work that we do, which is mostly in child welfare, and the work that you all are doing to support children and families in states. So we're hoping that this is a nice introductory presentation of CAPTA and some of the things that may be most relevant to your work, and would love to continue the conversation with you all in the future. And we'll share some ways that you all may be able to engage in the future towards the end. Next slide. This is us. Next slide. All right. Hi, everyone. Carrie Richmond. I am with the American Academy of Pediatrics and glad to be here this afternoon. Hope everyone's feeling energized to talk about CAPTA. So really just a brief overview of CAPTA, which stands for the Child Abuse Prevention and Treatment Act.
So CAPTA is the only federal law that's focused specifically on the identification, response, and treatment of child abuse. So CAPTA provides funding and guidance to support states and efforts that, again, fall into those three buckets of identification, response, treatment, but also prosecution is one thing that I didn't include in there. And really the goal of CAPTA is to provide care to victims of child abuse or potential victims of child abuse by integrating services provided by a variety of agencies. So one of the things that I want to flag for you all too is that that prevention piece of CAPTA has become increasingly more important over the years. And Rebecca is going to talk a little bit more about our most recent CAPTA reauthorization bill, which advocates in the child welfare community, I think, were really pleased with because of how much it focused on those prevention efforts, really taking things upstream. A few other points to flag on our CAPTA overview is that, like many others, it's historically underfunded. We're always in the fight for more money there and more resources to conduct these activities. And it actually expired in 2015, but that means that while the law's program continues, Congress needs to reauthorize, and reauthorization provides a really great chance to look at how it's working and how we can make critical updates so that it is more responsive to preventing child abuse and to those activities of identifying and treating. So next slide, please. Or Rebecca, did you have anything to add before we move on? Great. So one of the pieces of CAPTA is plans of safe care. And you all may be aware of plans of safe care, so hopefully I'm not repeating things that you already know. But really what a plan of safe care is a plan to serve infants who are born and identified as being affected by substance use disorder. So this is a plan that can be developed in advance of the baby being born, while the mom is still pregnant and it's been identified. And it can be developed by a designated community organization, and that might be a healthcare provider at the birth hospital, that might be a substance use disorder treatment provider, or it might take place as part of the discharge process when mom and baby are leaving the hospital. So states really vary on how their plans are implemented, and it can be developed by a state's Child Protective Services agency or by the Child Welfare Agency. Next slide, please.
Carrie, can I add one thing on there?
Yeah.
This was one of the areas that Amy and I originally talked about as being most of interest. If you could go back to the plan of safe care slide, sorry, thank you. That may be of interest to you all because we understand that you all may be playing a role in your states around implementing these plans of safe care. We'll go in a minute to some of the changes that the reauthorization bills would make to plans of safe care, but just wanted to emphasize first and foremost, as we're talking about more generally what they are, that these really were intended to be a prevention tool in federal law to connect infants with prenatal substance exposure and their families to services to prevent entry into the child welfare system later. These were created in 2003, and at the time there was sort of growing awareness of babies being removed from their mothers at birth or shortly thereafter, because the birth mother's substance use disorder was essentially considered de facto child abuse. And so this was created in an attempt to wrap around some services for that family and prevent that from happening and keep the baby safely with his or her birth parents whenever possible. And what we've seen in this latest round of reauthorization is Congress really doubling down on its commitment to making this the prevention tool that it was always intended to be. Go ahead, Carrie. Yeah. And this is my piece. Sorry about that. So We are, as Carrie mentioned, in the middle of a reauthorization process. It has been at least a few years in the making, and we've seen some incredible progress just in 2021 that we wanted to share with you. And it's sort of why we are coming to you today versus last year or even later on this year, although we do hope to have some updates to share later in the year. In March, the House passed their reauthorization bill, which they actually drafted and passed back in 2019, so 2 years ago. At the time, we quite frankly thought it was the strongest reauthorization bill that we could get. It made a lot of really important improvements to help CAPTA work better. It increased authorization levels. CAPTA, as we'll mention in the next slide, has been chronically underfunded, which has really hampered states' ability to implement the law's provisions effectively, including the plans of safe care provisions. It did a lot to increase accountability and transparency, which were also really big issues in the CAPTA program. And as Carrie alluded to, it took steps to really strengthen the law's focus on prevention and increasing family supports to prevent system involvement whenever possible. Since then, the Senate has been working to put together a reauthorization bill of its own. Those efforts were sort of put to the back burner when the pandemic hit last year. But then earlier this year, Chair Patty Murray, who's the chair of the Senate Health Committee, along with her ranking member, Richard Burr from North Carolina, have been working in a very strongly bipartisan fashion to craft their own reauthorization bill. And they introduced that in, I want to say, late May, and then passed it in early June. And it really took what the House did in terms of its goals, increasing accountability, increasing authorization levels, looking for ways to make the whole law work better, doubling down on the commitment to prevention, and really ran with it. So it was able to go much farther than what the House bill did. So the National Child Abuse Coalition, which I am representing today, the American Academy of Pediatrics, and many of our organizations in the child welfare space were really pleased to endorse it. And we are hoping that reauthorization continues to move forward this year. Next slide. Before I move to appropriations, I did want to note specifically related to plans of safe care. One of the things that the Senate bill did that really went beyond what the House bill was able to do was pull out the plan of safe care provisions from where they occur in current law and put them into a new Title IV, which is a brand new title of CAPTA that the Senate bill would create, focused entirely on connecting infants with prenatal substance exposure and their birth parents to services. And they've actually renamed plans of safe care family care plans, again, recognizing the emphasis on family strengthening services. They made a lot of updates to the language around plans of safe care as well, again, with that sort of broader goal in mind of preventing system involvement, connecting them with services that they need, and really thinking about what a public health approach to plans of safe care would look like. Among other reforms, it actually changes the way that those plans would be administered, and it allows the governor of each state to determine which agency will be responsible for implementing the plans of safe care. And that could be maternal and child health agencies. So it's possible if we see the Senate bill enacted into law that you all would have the ability to play a much bigger role and hopefully have a very positive influence on those implementation efforts. And just a final note about appropriations, because this is another area where we think that your partnership and your shared interest and advocacy could be really helpful for CAPTA. As we mentioned before, CAPTA has been pretty seriously underfunded. It's a pretty small source of funding in the grand scheme of child welfare services. So it's often overlooked by almost every advocacy community just because of its size. But Carrie and I think the other organizations represented in the National Child Abuse Coalition really feel strongly that it has huge potential for really serving as a key mechanism for providing family strengthening services to keep kids out of the realm of child welfare services and keep them with their families and safe and thriving. So we are committed to both helping CAPTA work better, as well as increasing appropriations for the program in service of that goal. So our coalition has been slowly kind of boosting the funding for CAPTA over the last few years, and we're really proud of the progress that we're making and hope to continue making progress in the coming years. Where we landed last fiscal year 2021, was total appropriations for CAPTA at around $186 million. $90 million for state grants, which is where plans of safe care currently fall, and $60.6 million for CBCAP, which are community-based child abuse prevention grants. We also were able to secure some pandemic relief dollars through the American Rescue Plan Act in March. And $350 million was allocated for CAPTA as part of that pandemic relief. States have to spend that by 2025. So they do have some time to figure out where those dollars go. And you all could certainly, to the extent that you are engaged in conversations at the state level, you all could certainly play a role in ensuring that those dollars are well spent. And I think that is it for our slides. Carrie, anything to add?
No, I do see some questions rolling in though, which is perfect because we were going to transition to that. So would CAPTA funding flow to the agency the government designates to implement the new family care plans? For example, if MCH became responsible for playing a much larger role in this work, would they see funding to support that work?
It's a really good question, and I would want to go back to the statute to make sure that I get it right. My understanding is yes, that point agency would be the agency that receives that money to implement, but I want to confirm that before I say definitively that that is the case. The reason I think it could flow through a different agency is actually Title II of CAPTA, the CBCAP grants, community-based child abuse prevention grants, actually typically don't flow through child welfare services. They flow through children's trust funds. So there's already good precedent in CAPTA for these different money from these different titles going to different places.
I think just the one thing and a larger theme to flag for you all in the work that you do on behalf of women and children and young people is that this CAPTA reauthorization bill also makes significant strides towards race equity and includes a lot of provisions to address the disproportionality that exists for Black mothers and mothers of color, and would make a huge difference to just have a more equitable system and response and investigations and all of those things. So as we are coming away from 2020 and all of the racial reckonings that were taking place, and as our organizations and our groups all look forward to how we can be a part of the needed change, I do think that is an important piece to flag here for you all.
And just one more thing in terms of next steps, we are expecting the House and Senate to pre-conference, basically come together and figure out the differences between their two bills and come up with what would be a final bill to bring to the floor of both chambers and then get sent to the president for enactment. Initially, we thought that would happen sometime this summer, but reconciliation really has been such a huge point of focus for Congress and probably will continue to be through the fall that we are not totally clear on the timeline anymore. But we do expect that CAPTA will be reauthorized this Congress. Ideally, it would be by the end of the year, but we'll have to see how things play out over the course of the fall, and would love to keep you all in the loop as things change. And if there are opportunities for you to join sign-on letters or, add this to your list of things to talk to your legislators about, we would very much welcome the partnership. How can we learn about additional equity provisions from CAPTA? Any summaries that highlight this? Lisa, it's such a good question. And in an ideal world, we would have all of these summaries packaged up and ready to go, and we don't. But we'd be happy to, what we can do as a follow-up and maybe work through Amy on this is send the summaries that we do have, which do flag some of these provisions, to the extent that other materials become available, make sure that Amy receives those as well so she can distribute them. I certainly would expect us to prepare things like that once the final bill is enacted, but we do not have those to share right now.
Thank you. And I'm going to make an offer. Another way to engage with AMCHP and our members is we do have a member committee focused on addressing health equity mostly, but we, can always be available, and I'll put Lisa on the spot too. She's from New Jersey and fabulous resource. So perhaps if there's ways that, if we could be helpful to you guys in your work in, helping inform if there's, revisions coming out, especially with the legislation specific to the prevention pieces, the equity pieces, we, use us as a resource as well.
We'd love to. Thank you.
Thank you so much. So we have a few minutes left. Thank you so much to all of our guest presenters today, Rebecca and Carrie, Alan, Michael, Laura from the Bureau. Is there any questions for any of our presenters today? I'll also remind you that we do have our next call scheduled for September 2nd. We also post the recordings on our website after they've also been emailed out to everyone who was registered. So you should receive that. If you have any issues with that, feel free to contact me or Jess. I'll give another minute to see if there's any other questions. But I'm really, at first I was like, oh, I hope it isn't too confusing that we're having like a presentation on child tax credits, and then we're talking about CAPTA reauthorization. But really, I want to emphasize how important it is to open these lines of communications with partners from other agencies across the administration, and of course, also within the states. These are programs that are traditionally housed in other agencies, and using these webinars as a forum for learning about what partners across different departments and agencies are doing. So I'm so glad this worked out and that we had you all today, and maybe you even learned some things from each other. I'll say, Allie, you maybe even interested in connecting with Carrie and Rebecca about opportunities to present to their stakeholders as well for getting the message about how to make sure that families are taking advantage of the child tax credit.
Oh, I would love to do that. Thank you.
Sure.
I provided my contact information going forward so we can make arrangements.
Wonderful. Great. Well, then I'm not seeing any more questions. Happy to give you back a few minutes in your day. And we just ask if you have a chance to fill out the survey, maybe you can use those few minutes to do so. It really helps us with measuring the impact of these webinars and making sure that we're serving you all the best that we can. And I think you'll get that as soon as we sign out. So have a great rest of your day, everyone. Thank you.
Thank you, and be safe, everyone.
Thank you.